Julie Riddell, who's going to speak about sexual behaviour in Scotland during the pandemic. Julie, over to you.
Thanks, Alastair. No double act, just me. So I'm just going to share my slides, hopefully. Great, I think that's worked. So I'm Julie Riddell, and today I'm going to present on behalf of the Natsal-Covid study team. I'm aiming to give you just a bit of a flavour about some of the findings that we've found. Sorry. Need to click next. There we go. So just briefly, the objectives of the study were to rapidly understand how sexual and reproductive health in Britain was affected by the COVID pandemic. And as part of this, we were also aimed to disseminate the data to inform service design and provision, both during the pandemic and after, if we eventually get there. So just to give you a bit of a brief background about the survey, it was an online panel using quota sampling, and that was based on age, gender, region, and social grade. We used weighting in the hope of achieving a quasi-representative sample, and the questionnaire took about 10 minutes to complete. Our final sample was 6,658 participants, of whom 573 were living in Scotland. So just in terms of the timeframes that were involved in the survey, we carried out the Natsal data study at 2 time points. So data for the first survey was collected in late June, early August 2020, which was 4 months after the start of the first lockdown in the UK. Data for the second survey was collected between late March and late April 2021, which was 1 year after the start of the first lockdown. Both points of data collection took place just after a 3-month period of full lockdown and increased restrictions, and were separated by 8 months of tightening and loosening, depending on where you lived, of restrictions. And that's just shown in the wee blue bands that's underneath the timeline. So today I'm mainly going to focus on the second survey. So that's the data 1 year from the start of the first lockdown. So this is just to give you a very quick summary of the kind of topics that were in the questionnaire. And the points in bold are the ones that will be the focus of today's presentation. So very briefly, I'm going to cover number of sexual partners, sexual activities, including digital behaviours, sexual function, and what I think quite a lot of you are interested in, service use and testing rates. So the results. Click too fast. So just before I go into the details of our findings, it is important to highlight some key points. So for the presentation today, I am going to aim to present data for Scotland where it's possible. But because the numbers were lower in Scotland, at times it's not always possible to present the data aggregated. So in those cases, I'll present a combined data set. So for the full sample, Scotland, England and Wales combined. But I will highlight where I do that. It's also important to be clear about the terminology that we're using today, because we are presenting data by gender. So for today's presentation, men includes trans men, women includes trans women, and all includes non-binary people. So this is just hopefully to give you an idea of the overall makeup of those living in Scotland compared to those living in England and Wales. What we found that there were statistically significant differences between those two populations, so between Scotland and between England and Wales, and that was in terms of age, ethnicity, employment status, and relationship status. So looking at those variables that were statistically significantly different, you can see that 94% of the participants that were living in Scotland identified as white, compared to 85% of those living in England and Wales. 52% were educated to at least degree level, compared to 44% in England and Wales. 62% of those living in Scotland were in a steady relationship, compared to 60% roughly 60% in England and Wales. And there was no statistically significant difference in terms of those reporting symptoms of anxiety or depression, and also no difference between those living in England and Wales and Scotland in terms of sexual experience. So the following slides are going to present data for those who were defined as sexually experienced. And for the purposes of today's presentation, that's been defined as those who reported at least one sexual partner of any gender ever, or who reported vaginal, anal, or oral sex, or contact with someone's genital area in the last 4 months. So, turning to sexual partners, over 60% of sexually experienced participants living in Scotland reported at least one sexual partner in the year since the first lockdown, and there seemed to be no significant difference by gender. Next, we note that there was a significant minority of people who reported new partners during the pandemic. So for Scotland as a whole, there was only 19.4%. And that's of those who stated that they'd had at least one partner in the last year. Again, there seemed to be no significant difference by gender. Now, because the numbers for Scotland were quite low, I've had to present the data for new condomless partners for the full sample. So that's England, Scotland and Wales combined. And the data suggests that of those with a new partner in the last year, within the full sample, over half, or around 66%, reported at least one new condomless partner. So although the numbers were small, there were still some risky behaviours going on. So turning next specifically to sexual behaviours, there was no significant difference overall between the nations, and so I'm going to discuss just the Scotland data. As we can see from the slide, physical sexual behaviours, definition of which is on the bottom left, I'm not very good with my left and right, were more commonly reported, than virtual behaviours, and that's whether we included or excluded looking at porn. We can also see that there were significant gender differences with significantly higher prevalence of men reporting all three behaviours than compared to women. What I find quite interesting was the differences when we looked specifically at virtual behaviours, virtual ways of interacting with partners. So if we included those who reported looking at pornography, there was a significant difference between men and women, around 77% of men and 36% of women, which is the middle two bars in the slide. When we excluded those who only reported looking at pornography, so didn't report any of the other variables in the last 4 months, which is the last two bars in the slide, the difference between men and women, while still significant, does become much less pronounced. So 34% of men and 24% of women. Looking at differences by age, only virtual behaviours suggested a significant difference, with the prevalence of those reporting at least one virtual behaviour decreasing as age increased, which may also reflect the nature of people's relationships, with younger respondents more likely to be living with partners. Less likely to be living with partners. Okay, so turning next to self-appraisal of sex life in the year since the first lockdown. So looking first at satisfaction with sex life, we've actually got a fairly positive picture, in particular for those who were sexually active. And we also noted that women living in Scotland reported satisfaction more than men, regardless of sexual activity. Not shown here, we also found that those in a steady relationship were more likely to feel satisfied than those not in a steady relationship. If we look at those who report more negative experiences, so reporting distress or worries about sex life, experiencing difficulties with sex and avoiding sex, we find that men in Scotland were more likely to report than women, again, regardless of sexual activity. And although not shown here, there does seem to be a difference between those in a steady relationship and those not in a steady relationship, with those in a steady relationship less likely to report negative experiences. So this is a bit that I think quite a few will probably be more interested in. So this is about the sexual and reproductive health service use. And again, this is just a flavour of the data that we've got. So we find no significant differences between those who were living in Scotland and those who were living in England and Wales in terms of prevalence of trying but failing to access at least one sexual and reproductive health service. In total, so for the full sample, again, Scotland, England and Wales combined, there were 414 participants who reported at least one failed attempt to access sexual and reproductive health services. Of these, only 16% reported not accessing any service at all, which is shown in the top right box in the pie chart. This is actually a fairly positive message because it suggests that while people may have experienced difficulties accessing services, the majority did eventually be able to access one. We also asked people about how they access services, and those accessing STI services most commonly reported using telephone appointments, whilst those accessing contraceptive services most commonly reported using face-to-face appointments, although it should be noted that some of these people could have used multiple methods. So across the respondents, difficulty accessing condoms was less frequently reported in Scotland, which again is quite positive, and less frequently in older respondents and women. The weighted prevalence of those needing to but being unable to access condoms suggests that men aged 18 to 29 within those living in England and Wales had the most issues, followed by men aged 18 to 29 living in Scotland. There we go, sorry, I thought there was a slide missing. If we look a bit closer, we see that for the full sample, so again, Scotland, England and Wales combined, there was a much higher prevalence of men who have sex with men reporting needing to but being unable to access condoms, and that's reflected by the checked bar. In particular, we find evidence of a significant difference by age within men who have sex with men across the full sample. So younger men who have sex with men, which is the centre bar, were more likely to report needing to but being unable to access condoms than older men, or those aged 30 to 44. I hate saying older for that because that's my age group. So on to the testing data. So the data suggests that overall, participants living in England and Wales reported chlamydia testing rates in the last year that were higher than those living in Scotland. And whilst there was evidence of a pattern of chlamydia testing rates by age, this wasn't statistically significantly different. Looking at HIV testing rates, we see a similar pattern. So again, participants living in England and Wales reported higher testing rates in the last year than those living in Scotland. And similar to chlamydia testing rates, the testing rates did seem to vary by age. It's quite interesting to note that the data on testing rates do seem to confirm the surveillance data that Dr. Brawley presented in the opening plenary for those of you who were there. So finally, we looked at cervical screening in the last year. So using UK testing guidelines, if we took 100 people who were aged 25 to 59 and were registered as female at birth within a typical year, we would estimate that 26 would be invited to attend cervical screening, and of those, 18 would be expected to attend cervical screening, and that's within a typical year. In our sample, in the full sample, so Scotland, England and Wales combined, we found that around 10%, or 10 out of 100, attended cervical screening in the year since the start of lockdown. If we look just at the Scotland data, we found 7 out of 100, or 7% of the Scotland sample, reported attending cervical screening in the year since the start of lockdown. Now, although there were lower rates within those living in Scotland, it should be noticed that the differences were not statistically significant. So, in summary, most people remained sexually active during the pandemic, and within Scotland, around 1 in 5 people reported a new partner. 27% of those living in Scotland reported using at least one sexual and reproductive health service in the year since the 23rd of March 2020, with only 7% trying but failing to access at least one sexual and reproductive health service. We also find that it looks like there were less reporting needing to, but being unable to access condoms in Scotland, which is a positive, but we also find lower levels of both HIV and chlamydia testing. In a typical year, we would expect around 18% of those eligible to attend cervical screening. However, only 7% of those living in Scotland did. Finally, I'd just like to add a wee caveat that because of the small numbers, we would interpret this data with an element of caution. So what are the implications of these findings? So it seems possible that STI incidence has reduced and that prevalence for STIs may also have fallen with a shorter duration of infection. But a key question now is what happens next post-restrictions? Whilst demand for some services might have reduced, we did still see a significant minority of people who reported risk behaviours and unmet service needs, which may reflect a backlog of HIV, STI testing and cervical screening. Online services were rapidly deployed, which has created opportunities to support people in different ways. Although, as Sue and Sally suggested in their presentations at the start of this session, we do know that these methods don't always work for everyone. And finally, whilst the groups needing services may have reduced in size, the key groups remain largely the same, many of whom experience complex intersecting needs. Lastly, I'd just like to thank the rest of the Natsal team and most importantly, those people who took part in the survey. And if you do have any other further questions, you can contact us on the Natsal website. Thank you.